everyone, I'm here with Dr. Chris Meckley from the Division of Rheumatology to discuss the risk of infection among patients with rheumatic disease. And so thank you, Dr. Meckley, for your time.
Thank you.
You're welcome. To start, I think it would be great if you could tell us more about your recent study on a rare but serious infection that can occur in patients with rheumatic disease.
Absolutely. So we studied an infection called PCP, which is also actually called PJP, which stands for Pneumocystis carinii pneumonia, which is a mouthful, I know. And as you mentioned, it's a pneumonia, affects the lungs, and it's pretty uncommon. But we know a little bit about it from other fields. So in general, this is an infection that affects patients who have a decreased immune system. So patients with cancer, HIV, AIDS, etc., and also patients with rheumatic disease. So in our study, we basically asked the question, how often is this occurring? And we looked only at our hospital, the Johns Hopkins Hospital, over the past 20-year period to answer the question, how often are patients coming in who have an underlying rheumatic disease and get diagnosed with PCP? And what we found is it averages out to about once a year. So fortunately, a rare occurrence, but it is a serious condition. So over the last 20 years, there were 21 cases of PCP in our hospital.
Okay, and are there any factors that predispose patients to the development of PCP?
There are. So we think that the underlying rheumatic disease itself can be a risk factor. Some diseases put patients more at risk than others, but probably the biggest risk factor, I should say, are high doses of immunosuppressive medications, specifically high doses of prednisone or another medication called cyclophosphamide. And both of these medications act to decrease the immune function.
Okay, and so are patients with rheumatic diseases more at risk for other infections other than PCP?
In general, yes, they are. In a small population, just having the disease itself makes them at slightly increased risk of having an infection. But for the most part, it's due to the medications we give them to lower their immune system. It's important to know there's a spectrum of immune medications. Some are on one end of the spectrum really potent medications that can really lower the immune system. But on the other end, they're more mild. And it's important for the patient to know where they fall on that spectrum in terms of the medications they receive. And that's a great conversation to ask with the rheumatologist. We believe, as rheumatologists, that the benefits of prescribing these medications certainly outweigh the risk of infection, or else we wouldn't prescribe them in the first place. But infection is a risk that patients need to be aware about.
Great. And so what are some of the more common infections, maybe that you might see a patient with rheumatic disease come to you in the clinic with?
Sure. So to be honest, there are similar infections that anyone would get. So these are viral infections, these are bacterial infections, and less commonly, fungal infections.
So what can patients do then to protect themselves against some of these infections?
Sure. So in general, washing your hands multiple times a day, certainly a good thing to do. Avoiding sick people. So even friends and family who may have the flu, a GI bug, that may not be the best time to go and visit them. And in addition, we really recommend vaccinations. A lot of patients don't think they can receive any vaccinations because they're on immunosuppressive medications, but there are some vaccines that are totally safe for patients. Specifically, we're talking about the annual flu shot, in addition to the pneumonia vaccines. And there are actually 2 pneumonia vaccines that they can get. There's a 13 and there's a 23, which sounds arbitrary, but there is a rationale to it. And patients are allowed to get those vaccines regardless of the medications they're taking. They should speak to their doctor about it because there are some rare allergies that you want to make sure you screen for before administering the vaccines. But in general, very safe.
Great. So then if a patient comes to you or watching this has a concern that they might have an infection, what would you recommend that they do?
I think the most straightforward thing is simply call their rheumatologist. We want to know when patients think they have an infection. Too often there's a patient who's on a potent immunosuppressive, things like Humira or Enbrel, and they're home feeling bad, they take their temperature, they have a fever to 101, and they basically, they don't want to bother the rheumatologist, or they simply want to just, wait it out. They can beat this at home. And that's not the right decision. We would like to hear from them because usually we would change something, whether that's holding their medications, asking them to come in for an acute visit, or even potentially prescribing things like antibiotics.
Great. Well, thank you so much for this really important advice, and we look forward to hearing from you in the future.
All right, thank you.
Thank you.